Hi, I'm Dr. Zachariah, consultant cardiologist at UHNM. The atrial fibrillation is an irregular heart rhythm where the top chamber of your heart, also called the atrium, starts beating at 250 to 350 beats per minute. It's a very common cardiac condition, especially as we get older. And at the moment in the UK, for example, there are about 1.5 million people who have atrial fibrillation. It's difficult to have a cause and effect definition for atrial fibrillation, but there have been a lot of population studies where we have analyzed the potential risk factors for atrial fibrillation, and identified risk factors include increasing age, being overweight, having high blood pressure, having diabetes, having other cardiac conditions like a previous heart attack, or having a leaky valve, and sometimes you can have atrial fibrillation with no other obvious cause as well. Diagnosing atrial fibrillation really depends on having an ECG or an electrocardiograph at the time of your symptoms, which we will talk about. And in this day and age, the first step, I suppose, is to feel your pulse. So if you feel an irregular pulse, then that needs to be followed up with an ECG. And these days, a lot of people have wearable devices like Garmin's or Apple Watches, which record beautiful ECGs. And sometimes this will help you to make a diagnosis. So really, you need an ECG to confirm whether or not you have atrial fibrillation. So the main issue with atrial fibrillation is the potential impact it has subsequently. The biggest risk we talk about is stroke. So having atrial fibrillation results in the blood flow in your heart being abnormal. You get blood pooling, you get clots forming, and these clots then go up to the brain and cause a stroke. So in the UK, 1 in 5 strokes occur in the setting of atrial fibrillation, and a lot of these people would never have known that they have atrial fibrillation. So that's why it's important to identify AF to mitigate that risk of stroke. And then secondly, we know that having AF increases your risks of getting heart failure in future. Risk of mortality is increased, and most importantly, your quality of life can also potentially be affected because of atrial fibrillation. The treatment of atrial fibrillation is really aimed at 2 things. One is preventing stroke, and the second is assessing and controlling your symptoms. So we'll talk about the first one. With regards to preventing stroke, we look at all the other risk factors that you have. For example, you're diabetic. Have you had a previous mini stroke or stroke? Do you have high blood pressure? How old are you? So you might come across a term called a CHA2DS2-VASc score. This is what doctors use to assess your risk of score, and if you're above a certain threshold, we would normally recommend that you go onto a blood thinner, which would include drugs like warfarin or anticoagulants like apixaban, rivaroxaban, dabigatran. There are different drugs available. So that's how we decide on whether or not you need to have stroke prevention. With regards to symptom management, the first thing we try to do once you've been identified to have atrial fibrillation is to try and control your heart rate. So we often find that we need to give you medications to control that heart rate, and we try to get it down to about 100 beats per minute or less. There are different medications we use. We try to bring the rate down, and sometimes we find that it's important to control the heart rhythm. So we try to restore what we call sinus rhythm, which is a normal rhythm of the heart. So for that, you have stronger medications. You might come across things like beta blockers for rate control, digoxin. And then when we try to control the rhythm, we use drugs potentially like amiodarone or flecainide, and these will need to be monitored closely by your cardiologist. So there's different options available there. And apart from drugs, we'll go into other treatment modalities such as a catheter ablation, which is more invasive, and we usually go down that route if drugs have not helped. And that would involve, an operation, not open heart surgery by any means. We go in through a vein in the top of your leg and do some work within the atrium or the chamber where the AF comes from. So there's different modalities available. AF cannot be cured. However, we try and control the symptoms as best possible, and we restore a normal rhythm by medications, or sometimes by doing a cardioversion where we shock your heart back to normal, or we do a catheter ablation procedure as I discussed previously. And the aim is to try and keep normal rhythm for as long as possible, but we're very aware that as we get older, it is again possible that even though you have had normal rhythm for a long time, that AF can come back. So there isn't exactly a cure, but we try to mitigate symptoms as best possible. Most common symptom tends to be an awareness of your heartbeat being irregular, so people report palpitations. Now, along with that, because your heart's now going faster than normal, you may find that when you try to exercise or doing something strenuous, that you're unable to do what you were able to do previously when your heart was in a normal rhythm. So you may report breathlessness. Depending on what other conditions you might have with it, for example, if your heart's not pumping very well, you might find that fluid is starting to build up in your ankles or elsewhere. So symptoms can vary, but the important thing is identifying that there has been a change in your normal way of functioning and trying to get it investigated. The simple thing is to feel your pulse and see if it's irregular, and that will then need to be followed up by a visit to the doctor and get an ECG done. If you're not happy feeling your pulse, that's absolutely fine. Getting an ECG is the key thing. And I'll take this opportunity to mention that there are different kinds of atrial fibrillation. There is what we call paroxysmal atrial fibrillation, where you don't have AF all the time, it comes and goes. So unless you have an ECG at the time of your symptoms, it may be that the ECG will be completely normal. And then there is another group where we have persistent atrial fibrillation, where you are in the abnormal rhythm all the time. And here it doesn't matter when you do your ECG because you're in the rhythm all the time, and that will again confirm AF. We know now that risk factors for AF include things like being overweight, drinking excessive amounts of alcohol, having a sedentary lifestyle, having uncontrolled high blood pressure or diabetes. So my advice would be, if you've been identified as having atrial fibrillation, it doesn't matter whether it's paroxysmal or persistent, i.e. do your symptoms come and go, it's important to sit down and look at your lifestyle and see whether there's anything you can do to change the way your AF is progressing. So exercise and weight loss would be top of the list. Looking at how much alcohol you drink. Do you drink a lot of caffeinated drinks or high energy drinks? And are your other cardiac risk factors controlled? Like, is your blood pressure adequately controlled, or your diabetes? So there are many things that one can do, and the treatment of one person will be different to the other, which is why it's important to have that conversation with your GP or with your cardiologist about how you can change the course of your AF. Exercise is an important part of managing AF. It's important to maintain a healthy lifestyle. It's also important to know that your heart rate, the changes in your heart rate will be different when you have atrial fibrillation. You will find that your resting heart rate is faster than what it was in a normal rhythm. And you may not be able to achieve what we call a target heart rate when you get atrial fibrillation. So we talk about target heart rates, which in a simplistic manner is simply 220 minus your age. So you may find that you only achieve about 70 or 80% of that when you have AF. The type of exercise you do is important. So we would generally advocate aerobic exercise. The other thing to mention is that while we encourage exercise, there is also the other extreme where we find that young people, for example, endurance athletes or people who do high intensity training, are actually at an increased risk of atrial fibrillation. And research suggests that that's to do with high endurance athletes having a slightly different top chamber of the heart, and that therefore aggravates atrial fibrillation. But on the whole, we would always recommend exercise, because not only does it improve your aerobic capacity, it helps you reduce your weight and hopefully improves your quality of life when you have AF. That's the whole purpose of managing AF in the right way. Because once you've been identified to have atrial fibrillation, it's important to sit down with your doctor and think carefully about whether the right thing for you is a rate control where we focus on AF continuing to stay in AF, but having the right sort of heart rate, i.e. doesn't go up above 100 when you're at rest, or whether we pursue a rhythm control where we try our best to get your rhythm back into sinus rhythm. So once that has been decided, then the whole aim of managing your AF is to try and get you back to your normal quality of life as much as possible. So sleep apnea is yet another risk factor that has been identified for atrial fibrillation. So sleep apnea is a condition where you stop breathing in your sleep, so there's a stop-start sort of mechanism. We routinely ask all our patients about their sleep patterns, whether they snore, whether they get tired and fatigued during the day, and if that's the case, or if we often have a low threshold for looking at this, and we conduct sleep studies in people who've been identified to have AF. The whole point is that if you have been identified to have severe, say, obstructive sleep apnea, then treating the sleep apnea would also highly improve your chances of maintaining a normal rhythm. Potentially, yes, because we know that population studies show that if you develop AF, there is an increased risk of heart failure and developing other cardiac conditions in the long term, so which is why it's very important to try and identify this early on and potentially mitigate all the risks that come with it.